And welcome to the 4 o'clock show. I'm Dave Elliott.
And I'm Karen Abernathy. As we come on the air this afternoon, health officials are now warning people to mask up again as a storm of respiratory illnesses and reemergence of COVID infections strike the nation. Joining us now to talk about how you can best protect yourself this holiday season is Medical Director of Singing River Pediatrics, Dr. Tyler Sexton. Dr. Sexton, thank you so much for joining us. Good to see you today.
Thank you so much, Karen. Good to see you too.
We're going to talk about kids in just a minute, but because the CDC came out with that announcement Monday that people should be masking up to protect themselves and to protect others if they're sick, what are your thoughts on that at this point, at this stage in the game? I know it's that time of year for flu, RSV, and COVID.
Absolutely. I mean, that's exactly right, Karen. These viruses are out there and they're out in force. And, you know, the same knowledge is still there. Masking and good self-distancing and social distancing and hand washing is the way to protect yourself. And COVID is not going anywhere. It's part of our viral biodome, and we need to continue to be mindful of that and protect ourselves as much as we can. And so these guidelines are just really a reminder. Not much has changed in terms of what we're telling people to do, washing hands, social distancing, all those things, but it's to remind you that it's not going anywhere and it's still infecting some folks, and we just need to be prepared and try to be as mindful as we can and protect one another.
Yeah, and interestingly, we did have a diminished flu season, diminished RSV as well, I'm guessing, during COVID because everyone was practicing those extra precautions. Does that have anything to do with cases being so high now, perhaps? Because people have, especially young children and babies, have never been exposed to some of these things before at this point.
It absolutely has. The one benefit of masking was these larger respiratory viruses, the flu, RSV, human metapneumovirus. These were all being thwarted by the masks that we had. We weren't coughing, we weren't throwing these particles around. And so we had a very low and mild RSV and flu season. And because of that, the last 2 years, these babies and these younger kids were not inoculated against this virus because we're doing such a good job overall trying to protect ourselves against COVID. And that obviously, anytime you're protecting yourself and masking and keeping the movement of viruses around from these higher particles that we can sneeze out or cough out, you know, these kids weren't getting sick. And now that we're not wearing masks as much as we were, you know, these viruses are coming back with a vengeance, and they are infecting a lot of children, especially smaller kids with lower airways. That's what these viruses do. They irritate the lower airways. They cause a lot of wheezing, a lot of congestion. And the best way to, you know, we weren't seeing it because there was such a good mask compliance, and the larger molecules were being thwarted and not getting through the masks.
I know that small children can get into trouble quickly if these issues aren't addressed, if they turn serious. So what should people be looking for, and when should you seek medical help for your child?
Absolutely, great question. So the big thing is for RSV and these kind of symptoms is if you're seeing you're using your tummy to breathe, if you have a lot of congestion that is not allowing the babies to eat effectively, that they don't have enough urinary output, they're not eating, and they're very congested. The reason that you would want to come see your doctor is if you have a lot of rapid breathing, or called tachypnea, and then if you have inability to eat. Those are the two reasons. And your doctor will look at your oxygen saturations and suctioning. But the big thing you can do at home is using the nasal saline suction. You put a couple drops in the baby's nose and suction it out with a suction device like a bulb syringe. There's not an antibiotic that can be given for RSV. For example, it's a virus that has to run its course. And so the big thing is humidified air, sitting in front of a hot shower and doing suctioning is really important. But if you have rapid breathing and trouble eating, then you need to see your pediatrician and your doctor.
All right, Dr. Tyler Sexton from Singing River, thank you so much for joining us, and hopefully people will be taking some extra precautions during this flu and cold season, COVID season, RSV season. Thanks for being here today.
Thank you, ma'am.